But what it is really, it's about perception. Photography is really just a frozen moment in time, a snapshot. But there are lots of pictures you can take which will help you as a dentist with perception. And trying to find out what patients want is absolutely vital. Not what they need so much as what they actually want. Imagine what it's like trying to talk to patients about cosmetic dentistry, saying, well, you need some laminates, veneers, and the bond. You know, you're going to lose them. So you really need some simple photographs. But it's much better to, I think you said, to show your own photos. Have you got your own photos? And although there are lots of books, this is the American Dental Association, the relief books, very, very useful, a lot of these books. But the patient would much prefer to see what you could do. A lot of our patients don't want the American smile. And that's where your imaging is so good, because you're tailoring it to what the patient really would like. They know what zoom is. They want zoom, they want power whitening, they want laser whitening, they want veneers. They know what they all are now. You don't have to sell them, they're there. And so amalgams, very, very simple. Joe, you can change these in seconds. So perhaps if Joe had had even more time, he'll show you. It's so easy, far easier than doing the work. But there's a simple photograph you could all do just to show what it's like. There's a massive demand for private dentistry, and believe me, there's enough for every single one of us in this room and more. People are queuing up for it. Dentistry is selling itself, but there are ways you can show a patient or prospective patients what you can do. You can advertise cheap bleaching in the yellow pages or on your website. Our image isn't exactly that, but if you look in the Manchester yellow pages, they come next to demolition. There's a few demolition merchants near you in Hawley Street as well. Not you, Joe, because I've seen your articles, and you're too modest to say who your claim to fame is, but perhaps we can ask you about Jordan later, can we?